Hello, everyone. Hello, viewers. Welcome to the next edition of Health Forward. It's my privilege today to welcome someone very special, Mr. Mittal. He's been the former chairman and president of NASCOM, now also the chairman for Patients for Patient Safety Foundation. Someone who I have been watching or observing very closely. I have been having an opportunity to work with him in some way or the other. I really find him a very calm person who has a great clarity of thought. Very nicely and in a subtle way, he puts his point forward, which makes so much of sense when you sit back and you think about it. Thank you, sir, so much for being here with us today. Really appreciate your time.
Thank you, Gaurav.
For this.
No, thank you for your kind words, Gaurav. And I've enjoyed being part of IPSC, and I'm sure this year as well is going to be a great success. I really wanted to thank you for, in a conference like this, giving patients a voice. And I think that actually shows that finally we are getting, there's so much that the healthcare professionals do, but here you're getting a patient really to talk about it. And I represent patients even in this podcast today.
Thank you, sir, so much for all the nice words and for your time once again. So, sir, starting with the first thing, which I'm sure all of us would want to know and learn from you and from your experiences, when anybody looks at your profile, they see and understand that, you have had a complete digital IT background in your career. Could you take us to the beginning of your journey? Like, what drew you more towards patient safety, patient advocacy at large?
Yeah, that's a good question. We might be in whatever profession we are, including in healthcare, we are also all patients, right? So I think that's a reality that will be there. But to your point, I was invited by CAHO, an organization which was trying to do on quality and patient safety. And they asked me to help them get technology and healthcare together. And I came in as a technology person. And when I was sitting through their presentation and I heard about safety, I heard some alarming numbers, which I couldn't believe. That in spite of everything that's going on, how come 1 in 10 people who are hospitalized get harmed? And that was very intriguing for me. I was just wondering why something like this would happen. And I think that was where I started getting involved. And I thought these numbers couldn't be correct. So I went and checked out on WHO. I went and checked. It wasn't about developing countries or developed countries. Even in developed countries, it was happening. It wasn't about urban and rural. It was happening all across. And I think that was the big alarm point where I think we said, can we do something on this?
That's really interesting. Someone who, how you actually just understand the statistics and the numbers, and that draws you into doing something which is like giving so much of your time and attention to moving across industries. I think really hats off to you, sir, and thank you for sharing that experience with us. Has there been a particular moment or an experience that largely transformed patient safety from an idea into a personal mission somewhere or the other for you?
So, it's interesting. I started reflecting that once we heard about 1 in 10, right? Then I realized, what, I've been through avoidable harm. And I said, my wife has been through avoidable harm. And when I was talking about this to my friends, then everybody had some story to tell about harm. And then we realized that, is there something that we could do? And, in the board that I am of a healthcare organization, I was participating in discussions on quality. And I was amazed how much do healthcare organizations work hard to keep us safe. How much money they spend, how much care they have. So why is it that in spite of all the efforts at hospitals, they're not ignorant, they're not negligent. There are standards, there is accreditation, whether it's JCI or NABH, things are happening. And then I realized there was one piece missing. And that piece was the patient himself or herself. We were not playing part in our own safe journey. So what we took on ourselves to do was saying, we will work with healthcare providers and we will find ways and means of telling patients what they can do to help prevent harm, whether it's at home or it is in their journey. And I think that is the moment that we said, wow, we have found what we want to do. And instead of doing this blame game and fight between provider and receiver, we will talk about what I, as the receiver of healthcare, will do. And I think that's where our journey started. And these stories have just made us more and more clear I could have also played a role in avoiding harm.
Yes, sir, definitely. I mean, for all the work that Patient for Patient Safety Foundation has been doing, focusing on patient education, advocacy, creating awareness about healthcare, I think that's definitely adding a lot of value to what to expect and how to deal with these situations when they visit healthcare organizations. Sir, as you've been working very closely with patients and families, any example or something that you can share on how these interactions, when you're working with them, have actually shaped your understanding largely of what is harm about, what is trust about, and what is the accountability that we are talking about in healthcare space?
So, every family, as I mentioned, had their story. There's not one time that we talk about it that people don't come and tell us, oh, this happened. And then we ask them, what did you do about it? They actually moved on, right? They actually told friends, they changed the doctor, hospital, whatever else, and they did nothing. And that's what they confessed. And we said, why, right? And then we realized that in our ethos, we were always taught, and rightly so, that doctor is God, right? You are doing such a noble work as a doctor. So we surrender ourselves fully to the healthcare side. And I think this was a good learning for us. We found that if they were aware of the harm that is likely to happen, then they will know. I'll just give you an example. A friend is same education background as mine, actually sent his driver with the prescription, and the pharmacy said, please take this medicine, but I don't have the same brand. He says, have you checked it? He says, yes. Now, we still write in pen, pencil, or whatever prescription. We have a joke that his handwriting can only be read by a pharmacist. But they made a mistake. This person was having this tablet twice a day when it was probably supposed to be had once a week, and it wasn't been related. Lo and behold, after he finished his first strip, he sent the driver again with the strip to buy. And he was in ICU for 16 days after that. Now, who do you blame in this? The handwriting of the doctor, the pharmacy guy, or me as the person consuming it? Now, in this chain, while we will tell the doctor to write in bold, we will ask the pharmacy person. But then even today, if you look at the medicine names, they are all sound alike, just one alphabet difference. Good. So we are now educating people, look here, it's very easy. You go to Apollo 24/7. If you download, you will get the composition. So you can check whether the alternate medicine is there or not. So I think these are the kind of things that we are learning ourselves. And by the way, we didn't come with this knowledge. We started finding out where mistakes are happening. So we started mapping the journey.
That's very true, sir. Actually, if I could think of something like that, so I was visiting one of the countries for an assignment, and when I had a problem, I was given the advice that was given was double the dose of what was required, and I actually took it for 3 to 5 days. It was not a medication which was critical, so it was all fine. But it just, as you rightly said, it could have been just a look-alike, sound-alike, and each one of us have gone through something or the other, because a lot of us just pop up medications at home, or any of the things that we go through. So, sir, thank you again for sharing that experience. In all your interactions with patients and families, what's that one unexpected thing someone has said to you that actually made you smile even in a serious moment?
everywhere I go to talk, they now start putting a prefix called doctor in front of my name, right? And I have to tell him I'm not a doctor, but I think we are learning as well. And I remember my trying to explain somebody on some issue on preventive checks, and he says, "So you explained it so well, so much with empathy. Even my doctor doesn't." Right? So I said, suddenly we are being put on a pedestal that we don't belong to. But I think it's good. It's a big journey for us. We are working on it.
I think, sir, I mean, everybody or every individual in healthcare serves a different purpose and a role. And it all adds up ultimately to safer healthcare, whether it's a doctor, a nurse, to even someone who is acting as a counselor, to even somebody who's cleaning a patient's room, or a security guard who's kind of protecting the property and patients in a healthcare organization. So I think it all somewhere or the other adds with their own individual contributions there. Sir, many patients actually hesitate to speak, and I know you kind of touched this point earlier in the conversation, that they hesitate to speak when something feels wrong. What do you think largely that kind of silences patient voices in the most healthcare settings?
So, I think first we should remember that nobody comes to the hospital by choice, right? You go to every other place. If there is one place they don't come by choice, it's the hospital. And when they come, they are sick, they are anxious, they are distressed, and once they also have a big fear of reprisal, right? If I ask a question, will the doctor say, "Google पढ़ के आए हो क्या," right? Or will he be very curt? There is a hierarchy in the organization that happens, and I think sometimes doctors get very upset if you tell them that I asked for a second opinion, and he would say, "Don't you trust me?" So I think there is a whole issue there where people don't really speak up, and there is no forum for speaking up. The language and culture is an issue. But Gaurav, I'll just give you an example. This is very recent. In a large hospital, somebody very close to me went to a doctor, very well-renowned doctor, celebrity. There are 4 patients in his room, and the guy is attending this on the phone, and obviously he is stressed. And then his assistant came and said something. This person was shouting. Now, if in a doctor setting you shout, right, everybody is scared even to ask questions. So I think we haven't created an environment for patients to speak. Now, these are very different from customers to speak. You and I have customers of so many. We don't like a hotel, we call up and saying this is not there, the hotel room is smelling of smoke, or food doesn't taste good, you send it back. But what do I do? So I think part of the problem is the patient and what they're going through, hesitation and so on, and the other is the environment. So I think those two combined. And there are India, it becomes worse when it comes to language and culture, hierarchical structures and so on.
Probably, sir, sometimes it's just that tipping point, even for the healthcare professionals, because they go through so much of mental stress, which we have been talking a lot about these days, of the mental health. But I think it's very important to look at that also, and how can we help that while also ensuring that patients are ultimately respected, we are empathetic towards them, and we take care of their needs in an appropriate way that needs to be done.
Right.
Sir, let's assume and imagine that there is Aladdin ka chirag, or there is a magic wand that is given to you at this point of time now, that works only once in healthcare. What small but a meaningful change would you use it for with that wand or a chirag?
Yeah, honestly, I think I would hope that everybody gives a patient a chance to speak up, and a chance, not only chance to speak, for somebody to listen and then to act on, right? And when we talk about speak up, it's not about complain, it's not about cribbing. we're talking about somebody saying, doctor, I didn't understand. Doctor, I did not understand the discharge thing. Doctor, I've never been through an MRI. I'm scared. Can you please help me? Right? And I think if I had a magic wand, just that little empathy, right? And touch. So when we say he's a good doctor, it's not about the treatment. It's how the doctor came across, right? He explained, he asked, samajh gaye na, right? And I think that is what, if it happens, I think they will, and that used to be there. Except that the disease load, patient load has become so much. But that doesn't mean that we don't still find a solution for it. There are solutions. And honestly, Gaurav, if you ask me what are we doing today, we are actually trying to create that material which the doctors and nurses will never have time. So we are now saying, what is an MRI? What should you be cautious about? What is CT scan? Why are you questioning the doctor who is prescribing you an MRI? You need it because of this reason. So we are saying simply, when the patient comes, please take our QR code, scan it, which is okay. While he is waiting, he can read it, right? So we take away the burden from the doctor or the nurse, because we know they are under pressure.
Sir, I must say that I think it was a very beautiful thought what you said, and the way you put it forward was really very touching. If someone has to just visualize that situation, that there is a patient, there's a technician who's putting hand on a patient's shoulder and saying, "Did you understand?" or "Samajh gaye na," as you rightly said, in a very beautiful way. I think that really makes a lot of difference. Nobody is perfect. We are not perfect. I think all of us are attempting and moving in that direction to ensure that it happens at every interaction. But I think it's very critical, and probably this is something which people should definitely take from this discussion that we are having, to see how they can improve these settings in their respective organizations going forward. Sir, the other area, if we have to touch and move from one bucket to another zone, it's about transparency after harm. Now, transparency after harm is one of the hardest conversations in healthcare. And when we read literature, when we talk to many people in healthcare space, we understand that a lot of times, we don't even share these things with the patients, because unless and until something has been identified, let's stay out of it, let's keep away from it. Why to create that unnecessary discussion and kind of impact their vision or their image in the larger society? So from your experience, what matters most to patients and families in those moments?
So I think this has to be addressed in two ways, right? One is that the healthcare providers actually worry about medico-legal cases, right? Individuals, whether it is a technician, nurse, doctor, surgeon, right? They feel threatened and vulnerable if they accept a mistake, right? Though we all talk about that, don't kill the messenger, don't, all that. But I think today we are, but if I look at it from a patient perspective, he or she does not want money. They don't want to, they have no capacity to file medical legal cases. They are really doing because they're emotional. Their emotions were not handled, and it is out of anger, right, and frustration, that or anguish, that somebody goes and fights them. But we know that errors happen. Everybody makes errors. But if if patient is told that yes, harm did cause, why did it happen? What are the consequences? And of course, there are two cases of harm. One is harm, the other is fatality, right? Two of them are very different, but both are leading. I think holding their hand and even are saying, "Galti hui thi, humne seekha bahut," right, is the way that will satisfy me that, look, they tried their best, but this didn't work or that didn't work. It wasn't negligence that caused it. It was a judgmental error, right? I think that attempt has to be made. Today, my own experience is the moment you bring up a point there is a denial, right? In my own particular case, I had a test report which was bizarre. I should have been in ICU if I had that report. And I went back. I said, "Hey," they said, "we'll retest." I said, "No, I'm not interested in a retest. I want to go to the root cause because you people have such great processes of bar and so on." I was assured by the person who came to take my sample that it will be okay. And they actually found there were errors. But there was an attempt to saying, "Sir, galti ho jati hai, complaint mat karna," right? So I think it's a human, but I was not complaining. I hope somebody did work on it and correct it, right? So on the front of it, their only suggestion was, "Sir, हम repeat कर रहे हैं ना?" I said, "नहीं, मुझे repeat नहीं कराना. I want to understand हुआ क्या, because otherwise it will happen again." So I think we have to create an environment for this, and Gaurav, this has to start from the top, right? If we're going to punish the person, if he makes mistakes again and again, it's sheer negligence, right? And I think the person has no right? He goes zero tolerance on. It's like zero tolerance we have for frauds. If somebody commits fraud, what do? Out. But this is not fraud. It may be a genuine mistake. It could be error in calibration or something like that could happen. I think it will build trust, and honestly, I would think that over this period, the trust has been waning, right? Here is a patient and here is a healthcare provider. And when I say provider, it could be a diagnostic lab, it could be a imaging lab, or it could be the first ambulatory care, right? In this whole chain today, the trust level is going down. Patients don't realize that technology is getting better and better, and hence the diagnosis is getting smarter but they mistrust when a doctor recommends a test and they don't take it. I just lost a friend 4 months back where a doctor had prescribed him a test, and he said, "Ye to aise likhte hain," and the guy didn't do it, and 2 days later he was gone. So in all this, who would you blame? I thought patient should have had trust, but how does he build trust? If the doctor had explained, "This is what I suspect it is," even if he had said, "Hey, I'm not just prescribing the test to do it, get it done anywhere you want to, but this is very essential for you," I think that guy would be living today, right?
Yes, sir. I personally also feel that I think largely as a society, though we have Indian healthcare has come a long way from where it was, let's say 4 or 5 decades ago to where we are today. A lot of awareness among people, but I think largely as a society also we need to understand that we accept, we help, we handhold, we partner with healthcare organizations so that they are also comfortable. And the same thing applies on the healthcare organization side, that they are open to patients and their family members in talking about what you very rightly pointed it out on how do we share and work with each other like a partnership model, so that it serves, and ultimately it's for the benefit of humanity. If we know, as you rightly said, gave an example of the health your blood samples test report, it's like it's just not correcting your problem, but has this problem been corrected at large so that it doesn't happen to anybody else? You not raising a complaint will solve your problem, but has this been sorted and done at large that this another patient wouldn't face something similar? So I think there's a lot of maturity that we still need to get in from both the ends that really need to work together, and probably in the next decade, who knows where we will be. And I think the work that you and your team is also doing will definitely add a lot of value to where we are heading towards.
Thanks.
So looking ahead, what changes give you hope that patient voices will become stronger, shaping safer healthcare systems in the future?
I see we have been working on this for 3 years, right? Honestly, Gaurav, I thought it was an easy job because we looked at international. There were many foundations called Patient for Patient Safety, USA, Canada, and all. And we thought we'll just make it an Intel contextual stuff and leverage. We still leverage a lot of content that Apollo produces and others because you give a lot of guidance too. But then we realized that everybody was telling what the hospital should do. Nobody was telling what a patient can do. So we have been doing this. We're reaching out to, but what has been the most hopeful, what raises our hopes very much, guess who embraced us first? Hospitals, right? So today, many hospitals are putting up our content in their OPD, IPD, pharmacies. Simple things like we said, a doctor sees a patient, 30 patients or 40 patients in a day. How much time does he have? 7 minutes. No choice. Doctor has no choice. The load is so high. But in the 7 minutes, he has to see your record. He has to see your current medication, clinically examine you, understand your problem, prescribe and guide. All this in 7. But did you go prepared? So we have a small document which says, how do you prepare for a doctor's visit? 6 steps. Now, these 6 steps are being put up in OPD. Who's putting it up? The hospital. So there is hope. They are well-meaning, right? In fact, I have a problem with patients because they write to me saying, Som, what a noble cause. And I ask them if they read it. They haven't, right? But we'll get there, right? Because I think this partnership has to be there. We have to do it. Whenever we present in webinars, we hear stories, and then now they're asking us to do more and more webinars. So I think we'll get there. We should not be satisfied with where we are, right? We have accreditation, absolutely a must. But accreditation levels today, if I have to take gross numbers, they are probably single digit as compared to the number of beds that exist, right? And accreditation gives a process, but we have to follow it in not only the letter, but spirit. And the question is, how do we go beyond the accreditation, right? How do we get truly patient's voice in? It's getting there because the intent is correct. I don't think anybody I met in the healthcare professional doesn't have. Your whole conference is called Patient Safety Conference, right? So that's the focus that you're putting in. So I think we will make a difference combined. We all have a role to play, like you said. You mentioned every strata in the hospital. Similarly, families, parents, right? Caregivers, all of us have our roles. We will be helping through our foundation, you and the patients to get the right outcomes at the end. And we hope it works. It's a long journey, but we'll get there.
Thank you, sir. I think you really summed it up largely in a very beautiful way. My one last question to you, sir. If there is one message you wish every healthcare leader would truly internalize about patient safety in their respective organizations, what would that be?
We just like we treat doctor as God, in the Japanese ethos, they say customer is God, right? So there has to be a time where patient is not an object, right? You're not treating his disease, you're treating the patient. You're treating a customer. And if that customer focus comes in, everything changes, right? I would think all of us will fall sick in spite of all the preventive stuff we do. How would I, as a doctor, like my family to be treated? Please treat every other patient the same way as you treat your family. And I heard this expression in the healthcare that would you do this to your grandmother? Would you do this to your wife, to your mother, to your child? I think if everyone in the organization keeps repeating this sentence to themselves, I think we'll get there.
Yeah, I think, sir. Yeah, you're very right. Actually, in one of my earlier sessions, I had Dr. Jim Molino, who's the Chief Operating Officer at JCI. He shared one of the examples very beautifully. He put it forward that he had an interaction with one of the patient's family, and they said that this is the first time we feel that someone has treated us like a human being and not as a patient. And when you were talking, I could relate to that because he also said something similar, and you even spoke about it in your previous question that you are talking about. I think that's really important, very critical. How are we being empathetic? How are we being kind to our patients and putting ourselves in their shoes and going through that process? And one of the things I think which is also very important is, sir, which we follow as like a basic ethos, that we uh, design a process keeping yourself in the shoes of the patient, not as what is convenient to you as someone who's sitting behind the billing desk or behind any other counter. You make the patient go from one counter to another counter, but because it's easy for you, because it's comfortable for you, but not for the patient. So I
Right.
think I think that's all very beautifully summed up by you in that line, sir. So thank you so much for sharing.
Thank you. Lovely. Enjoyed the conversations.
Thank you so much, sir. It was really a great time having this conversation with you on this, some of the key learnings and experiences that you shared, and I'm sure a lot of healthcare fraternity that is, kind of joined healthcare or learning and moving forward, they'll get to really learn a lot from your experience to move forward. How somebody who has been completely non-technical in healthcare or hospital background comes and moves into till a stage that people start calling him a doctor. So thank you so much, sir, for your time. Really appreciate that and loved having this conversation with you.
Thank you. Thank you so much, Gaurav. All the best. Take care.
Thank you, sir.